Hello, I'm Paul Selby. I'm the lead pharmacist for the Eastern Liver Network, which is the operational delivery network in the east of England. And as such, I'm heading up the Community Pharmacy Hepatitis C Antibody Testing Initiative. I'm doing this on behalf of the regional team, and we're based out of Addenbrooke's Hospital in Cambridge. By way of an introduction to the service, I'm going to run through the aims of the network in the east of England, how the service is expected to run, and where the resources are for you to successfully test patients. So firstly, the Eastern Hepatitis Network was set up as one of 22 national ODNs to expand treatment for hepatitis C and provide a focal point for finding the thousands of patients expected to have hepatitis C, but who are undiagnosed. We are one of the largest networks by area and cover all of the East Anglia region through hospitals in the area. There are 7 partner hospitals in the network, and treatment or testing is provided through either the base hospitals or via outreach provided by those partner hospitals. There may be some overlap between operational delivery networks. So for example, your pharmacy may be in a catchment area for another hospital. If this is the case, you will be contacted by those networks. The neighbouring networks are listed online, and the details will be provided at the end of this video. We also have close links with our drug and alcohol providers in the east of England, our Hepatitis C Trust peer support workers, and prisons in the region. We're pleased to welcome Community Pharmacy into the fold and look forward to working with you to help us find patients to treat in the east of England. So what does the service offer? Well, based on the service specification agreed between the PSNC and NHS England, you are able to sign up your pharmacy to offer antibody testing to people who inject drugs, who I will refer to as PWIDs, where they do not have access to testing, specifically where they are not otherwise engaged with drug and alcohol services or being managed for opiate substitution by a GP. Confirmation of whether a patient is engaged with their local services can be made verbally, and therefore you can use this as a marker of whether the patient is engaging with testing programs or not. The antibody test is completed using a point of care test, and I'll discuss this in a few minutes' time, but this will help us find people who have antibodies to hepatitis C, which means they either currently have or they've previously had hepatitis C, and if they've previously had it, it means they've had it and cleared the virus. Patients who are positive for HCV antibodies can be referred on to the Eastern Liver Network, and we will allocate patients to a local centre for further tests and treatment if needed. An important and understated part of this service is the counselling and advice that you can provide to patients, including signposting patients on opiate substitution treatments to test via their drug and alcohol services, or their GP, depending on the prescriber. Similarly, patients coming for needle exchange can also be supported and referred for follow-up with drug and alcohol support services. People who continue to inject drugs should be tested for hepatitis C every 6 months, and the community pharmacy programme can continue to support this. Support materials for patients is available on our Eastern Liver Network website, or would be available via request on our nhs.net email. The antibody test is completed using blood taken from a finger prick. Following consent of the patient, the test can be performed and the result read within 15 minutes, confirming the presence of antibodies to hepatitis C. I will not be going into details of performing the test, as a good video is available from Matrix Diagnostics, and it's held on the Eastern Liver Network website. If you would like specific face-to-face training from Matrix Diagnostics, please get in touch and we will try to accommodate this. The testing kits can be ordered directly through Matrix Diagnostics. You may also be able to order these via AAH, but you should check directly. Details on contacts and how to order are provided on the Eastern Liver Network, along with order forms and a bit more advice on how to do that. Within the service specification are consent forms and referral forms to notify the operational delivery network and GPs that patients have been tested and the outcome of that test. These form the appendices in the service specification. However, as the network has consented patients in testing events elsewhere, we've used this experience and what we've learned from that and adapted a version of our standard consent forms for the community pharmacy scheme. This one form includes aspects from both the consent and referral forms in the service specification and allow all the information and consent to be completed at the time of the test. We've also added consent for referral to drug and alcohol services in order to provide the appropriate safeguards for people with a history of injecting drug use, and added consent for follow-up with a hepatitis C peer support worker. We're also proud and pleased to be able to launch this on Farm Outcomes as a way of digitizing and giving an electronic version of referring patients into the Eastern 11 network. If you'd like more information about this, please get in touch or look at the video from the webinar. The Hepatitis C Trust is a charitable trust that works to support people with hepatitis C. The Hep C Trust work closely with all of the networks, and we have a peer support worker for the region whose job is to engage patients and support them in testing and treating. You may be approached by the Hepatitis C Trust or their peer support workers to ensure you're aware of how they can support you or how they can support patients tested under the scheme. As I've suggested elsewhere, we're keeping all of our critical documents and links to the training videos on the Eastern Liver Network website. If you're watching this video on the website, it's likely that you've already found where we are keeping our resources, and they'll be set out below. However, our training plans don't stop here. After registering for the service, you'll receive a follow-up call, and we are running recorded Zoom webinars where you can join me for a question and answer style meeting, which will support you with questions relating to the hepatitis C antibody testing. You'll also find the video from the webinar recorded, and that's below. Finally, I do want to encourage you to share your experience of the testing scheme with us. We are looking at, as a region, at how we can support more testing via community pharmacies, and we want to be flexible in reaping the benefits we believe are there from the location of community pharmacists and the relationships that they have with patients who are either in needle exchange programs or on opiate substitution programs or in a rural environment. So once again, welcome to our hepatitis C testing team, and good luck.